Hi there, Andrew with Zang Physical Therapy, and I want to continue the conversation from the other day talking about knee arthritis and why it is important to save your knees now and not later. And this is an important discussion to have because so many people in their late 30s, early 40s, maybe 50s, they're seeing their primary care doctor for yearly physicals, or they may have seen an orthopedic because they may have stiff, sore, or achy knees. And so often doctors, oblige people's need to know what's going on, and they do the cursory x-rays. And of course, because the person's over the age of 40, it's going to show a little bit of wear and tear, maybe a little bit of thinning of the knee cartilage, because that's the type of thing you can see on imaging or what doctors think that they see. And they tell people they have arthritis and just go live with it. There's nothing can be done. And this starts a bad cycle. So people think that there is nothing that can be done. And so they become less active, less physical, and maybe they put on weight and their knee function deteriorates because they're not doing anything healthy and productive for themselves. When, again, if you're over the age of 40, any imaging is going to show some age-related changes. They're just normal. That doesn't mean that that you have to have pain at that moment, or that you have to develop pain at any point in the future. Okay, the development of pain relative to the knees is really multifactorial. So you can't go by just one thing. So if you're looking to ignore what any doctor says, which would be a good thing, and you want to remain active and you want to keep those knees and you don't want replacement parts, then now is the time to act, not later. Later may be too late in the case of trying to recover and regain knee function. If you take the time now to improve your strength, improve your flexibility, improve your balance, to stay active, you're going to keep those joints healthier for years to come. Many people like to point to runners as a group of people who's going to have problems in their knees later as a result of running. But you know what? They've done studies on distance runners, marathon runners, and track these people over 10, 15 years or more, and they are at no greater risk of developing knee problems than the person who doesn't run. So what that shows you is that physical activity doesn't put you at any increased risk and may actually be protective for your joints. Think about that one for a moment. Physical activity, protective of your joints. And why is that? Because you're constantly bringing fluids to the joint. You're constantly stimulating the joints. And this is the way that joints and your body stay healthy. Inactivity leads to things breaking down. Think about that classic car that somebody has restored, and they take such great care of it, keep it in their garage, they polish it, and they change the fluids, and they do everything they need to do. That sucker will just purr along amazingly. Versus the car that you drive down the road and you see in the junkyard and is rusted, because nobody is taking care of it, and the elements are destroying it. That's what we're doing to our bodies by not being active. We're letting nature destroy our bodies because we're being lazy. If we take the time to feed it right, to stimulate it right with some kind of physical activity, whatever you like is fine, we will keep our bodies healthier and keep our engines running much, much better. Okay? So this is a very important thing. If you're somebody who has knee aches or pains, now is the time to do something about it. Don't wait 5 years. Don't wait 10 years. Don't even wait 1 year. Go get help. Go learn what needs to be done so you can tune your body and those knees back up so you can enjoy what it is you want to enjoy without those knee aches and pains and without having to go back to that orthopedic someday and say, give me a new knee. That is not something that I want for myself or for any of the individuals that I work with or my family members. So take the time, do what you need to do now so that you don't suffer in pain later from having a major surgery. So I hope that this answers some questions. I hope this gave you some motivation and some initiative to take that next step to work on the health and well-being of your knee joints so you can do the activity you want to enjoy. If you have any questions, please put something in the chat bar below, send an email. I'm happy to have and continue a conversation further because I feel it is very important to work on your knee health. And it's a very simple thing that a lot of people can do at home if they just learn what they need to do. So again, if you have any questions, let me know. Otherwise, have a nice day.